to join us when we're actually discussing the item, which I think will be more relevant, and I hope they're comfortable with that. And I'm going to move that we now take our smoke-free item now, and I'm sure there'll be a seconder for that. So that's item number 14, seconded by Councillor Wayne Walker. I'll put that. All those in favour, please say aye.
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 Against? Carried. Now, just while we welcome our staff up, I do want to signal we're just working on a recommendation here, which the staff have been given some preparation for. Have you got the wording? Yeah, no, we're working on it. So, Kat and team, if you'd like to join us. It's clear to me by the number of amendments that have been coming up and by the presentations we've had and by the concerns that people have expressed that this is a good starter for 10. It perhaps doesn't pick up some of the points that were raised by the previous council, but remembering that sometimes politically we say one thing and do another, and we are often a little bit ambivalent and hard to understand and hard to interpret when it comes down to the wire. So I just want to acknowledge our staff have taken all of the information that's been presented and put it together in this item. But as I said before, democracy allows us to make changes and to change the process. So what I'm going to recommend is that we can have some of the discussion now, but in the interests of time and practicality, I'm going to recommend that the staff make amendments to the policy, picking up the recommendations from the stakeholder, but that we actually bring this back to our October committee, and that in the interim that we have a political working party to just help work some of this through, and we can work out who we might like that to be, and the political working party in conjunction with the IMSB, and that then as part of what comes back to us in October, we come back with the implementation plan as well.
Second.
I'll second if I can see that.
I'm happy to move that. Councillor Darby would like to second. And that, while we just need to refine the wording, but I will ask Kataraina and her team, who've done a huge amount of work on this, to make any comments that you'd like to make. Also, just understanding Councillor Cooper and the regulatory team are building up to dealing with the bylaw, but the time frame I think is quite acceptable to Councillor Cooper that this be pushed out to October, that we pick some of this up as part of the bylaw. So, Kataraina.
Well, we're just happy to take questions.
Happy to take questions? Okay, so I just think that puts it in a context. Councillor Casey.
Yeah, can you just explain to me why the ban relating to alfresco dining wasn't implemented as per the 2013 in this new raft of actions on page 337 of our agenda have come into play? Can you just explain why we didn't do what we said we were going to do?
Sorry, through the chair, I'm not quite sure what the question is getting at. Are you asking why the specific references to alfresco dining have changed in the two versions of the policy?
You've heard all the presentations, Mike. Why have we pushed it out further in terms of time?
Through the chair, if I could, I guess, clarify that point. It is not the intention with the wording of the policy that we would be pushing out alfresco dining implementation. In fact, the way that the policy is intended is that it would create opportunities to bring it forward. So in the previous policy, we specified that alfresco dining would be made smoke-free from 2018. Some of the comments that we've had from our operational partners across council has been, well, from 2018, we have got the mandate to be including it in the policy. By actually removing that specific reference to 2018 and just having it as, this is something that we are going to start implementing moving forward from here, then that enables us, as has been identified in the implementation plan, to begin to actually have those clauses starting to be built into our contract. in relation to alfresco dining immediately.
There's a complete mismatch then from what you're saying and what I'm reading, because I'm not reading that at all. I'm reading exactly as the submitters have said to us this morning, that it's in the 2019-2025 timeframe. Something we'll look at through
I
the
think,
extra
Councillor
work.
Casey, that's a very, very good example of why we need to just take a deep breath and perhaps look at the information that we've had from our submitters. I think there is a bit of talking past each other that's happening. We'll take an answer in a moment. I'm just trying to stick with the broad issue. I think we've heard a lot from our community. We now need to just take that little bit of time politically to reconcile the two views and to, strengthen where is needed, and also to understand where some of the practicalities need to be dealt with. Sorry, I cut across. Did you want to respond?
Mr. Chair, I just wanted to respond to that more specifically, that one of the 4 activities that we have scheduled for this year in the implementation plan. So it's item number 2.29 for this year. It says that we will work with the licensing and compliance department to develop best practice methods of phasing in smoke-free requirements under the council's outdoor dining license renewal system. So that's an activity that's scheduled for this year.
Yeah, but that's one of 11 activities, but still I see it in the final column. So we are talking past each other. If that's what you're saying, I accept that, but that's not what I'm reading.
Yep. So this feels like sometimes it's worth just taking a moment and getting it right. Councillor Hills.
Oh, sorry.
Smoker's cough.
Sorry, do you want to take a moment?
No, it was. I would like to speak to whatever is, as opposed to ask questions.
Okay, so we're just on questions. Councillor Cooper.
I suppose it'll probably be taken up with the working party, but just a bit of an elaboration around the e-cigarette conversation, given some of our submitters talked about, they thought, well, maybe it's confusion, but then other people said it was a really good way of stopping smoking. Is that something worth looking at again, finding a bit about the etiquette stuff, or working with those groups to find a way to kind of manage that practice?
Through the
Or
chair.
is it more the working groups sort of? Thanks.
Through the chair, I'd like to answer that. What we've done is canvass through our consultation all the different opinions from our different stakeholders on that issue. And what we've done is used a research and evidence-based approach around whether to include e-cigarettes and vaping in the smoke-free policy. And what we found was, through that research, was that the UK, who has a longer history with using e-cigarettes and vaping as smoking cessation, put out a guidance document specifically for policy making around smoke-free environments, and it has 5 points that guide to policy making, and they are making a clear distinction between vaping and smoking, so in other words, it shouldn't be included in a smoke-free policy. Ensuring policies are based on evidence of harm to bystanders, evidence that identify and manage risks of uptake by children and young people, and to support smokers to stop smoking and stay smoke-free is a key thing for smoke-free policy, and to support guidance with smoke-free law and policies.
Thank you. Thank you, Madam Chair.
Thank you, Councillor. Councillor Newman.
Thank you, Madam Chair. A question in relation, at para 52 in your report, it talks about activities identified in the future 19 to 25 will remain subject to future decisions and resource allocation and budget, including for long-term plan. So my first question is, what initial advice, if any, have you prepared to inform officers' recommendations around a budget bid to ensure that we can resource a response and implementation at a regional level?
So one of the key things, through the chair, one of the key things we'll be looking at is taking a look at the implementation plan and working with stakeholders about what are priority actions for council
to support in its role versus actions for others in their roles. And then that would be part of the long-term plan process. Just as you considered during the annual plan implementation funding for smoke-free policy after you made some decisions around the review. So that would be fed into the long-term plan.
Can I, sorry Madam Chair, just to follow up, can I take it from that work hasn't yet commenced to inform what the implications would be?
No, not in detail.
Can I ask one further question, Madam Chair? At table 2 in the report, it's set out on, for people who've got hard copies, page 336. 2.10, it says, work with each local board to identify the smoke-free priorities for their area and the best way to implement smoke-free in those spaces. Am I interpreting that correctly, that this kind of feels like you work with the local boards, for the local boards to determine, and I suppose the local boards to fund the response?
Through the chair, no, that's not the implication. So the previous policy, the implementation was reliant on local board implementation and to be funded by local board funding because there was no regional budget for implementation. What we've done with the revised policy and the implementation plan is to not have that as the case, to have it a systematic and consistent approach at a regional level. What that item number 2.10 is, it's identified as the future, so from 2019 to 2025, is working with local boards to develop some community initiative-based initiatives and programs that we can do at a local level that will work towards, making Auckland smoke-free by 2025. But we don't have the resources available in this year's budget to undertake that task with each local board. That's why it's identified in the future column. So it will be reliant on future budget at a regional implementation level in order to work that through with each local board, which would be a best practice and we would recommend that we want to do. That's why it's in the plan.
Just one final point, Madam Chair.
Through the chair, I just wanted to add to that in a reference to paragraph 25 in the report and the funding that has been allocated through the annual plan for this financial year for implementation of the smoke-free signage in particular. So there has actually already been a financial commitment made towards the implementation of the plan, which is a huge step following the report back last year, so acknowledging the council's role in that. That funding was specifically for CapEx, so we're somewhat limited in its the way that it can be used. So that's why those sort of more operational type of responses have been pushed into the following financial year so that we can have further discussions around operational budget to be able to deliver on those.
And you're going to get on with the activities identified at para 52 this calendar year to try and inform advice for the long-term plan. Okay, thank you.
So councillors, just to Councillor Newman, what Councillor Newman's talking about on page 314, the implementation and the funding is set out quite clearly in paras 50, 51 and 52. However, I take you back to the last annual plan where we were less than forthcoming with funding for this. So let's just remember, before we complain about what hasn't been implemented, we can't implement what we don't fund. And we weren't very generous with the funding we gave this when it came to the actual annual plan. So let's keep our dots joined. Councillor, Mayor Goff.
Thank you, Madam Chair. My questions follow along the same line. I'm keen to implement the recommendations that are being made to us, but in order to do that, we need to know that we have the time and the resources to do it properly. Because if we just do it as a, this is an expression of hope, that doesn't get us there. So my question is this, what additional resources and what time constraints exist in order for you to be able to adopt the recommendations recommended to us if we decide to do that.
Sorry, can I, through the chair, can I just answer the implementation question first, and then look at what the recommendations specifically are that you're talking about?
Can I just, sorry to cut across between both of you, I think this is a almost impossible question to ask because and answer, because let's be really clear, we're going back a little bit to the drawing board on the policy. The policy will affect the implementation plan. Until we've decided that, Mr Mayor,
Sure.
we can't actually ask the staff what the budget's going to be. We need to finish our piece of work, and then as it says quite clearly in paras 51 and 52, that's when the budget ask will be developed, that will then come back to us.
With, if I can, Madam Chair, just to clarify that, I'm asking if we were to adopt what the smoke-free groups have advocated to us, what are the constraints and time and existing resources that you would have to overcome in order to be able to do that? So it's hypothetical, it's not saying we have adopted it yet, but if we were to do that, what would be the resource implications? I realise it's a ballpark figure. What would be the time implications? And you've also mentioned we need to work with other groups and it's not just an in-council thing. So I'm trying to work out what sort of barriers might exist if we were to adopt those recommendations, if that helps clarify the question.
That's clearer.
Through the chair, these would be the general barriers that we would face based on the presentations you heard this morning. So generally, we have no social change promotion budget to promote smoke-free beyond CapEx for signs and the normal communication resources we have to communicate any particular strategy or policy. We have no dedicated staff who monitor the smoke-free policy on parks and public places. So we've seen a presentation where people have asked us to go, if we've said an area is smoke-free, that we will make sure that is so. So even though at the moment it's non-regulatory, we have no implementation staff to undertake that function. We offer no smoking cessation services or service delivery. So one of the number one methods of reducing smoking for individuals is of course through smoking cessation programs. We have some resource through a Healthy Families contract with government and the Department of Health to assist with healthy families. So the team and the TSI uses some of those contract resources to try and improve the reduction of smoking amongst Māori and Pacific peoples in the south. But generally, you have a very little bit of policy resource, which, as you know, is only good for policy. So much good for getting anything happening on the ground. You have a tiny bit of comms resource, and we have CapEx to basically do the signs to implement the policy. And so most of that resource that we've already identified, we've put into the current activities and the activities that you see in 28-27. They're the ones that we can promise that we can deliver. Everything else, we don't know where that would come from, and without perhaps some kind of implementation package, many of the things people have asked for this morning would be very, very difficult to do within BAU.
Okay, can I just a follow-up on that? To the working party, you'd be able to come back to the working party and quantify the sort of resource you'd need, such as the dedicated staff. But what about the time constraints? Obviously it takes time. If you're going to do it, you've got to do it properly. Can you do that within the time frame that is being advocated, if you had the resource?
I think that if we had the resource, because council's not in this alone, this policy is about council's contribution to the national target, and we are seeing a little bit of a drop-off in government activity, hence the reduction in contracts that many of those who are in the smoke-free area have experienced. But if we actually had more and we were able to work with those delivering direct cessation services, then I think our denormalisation attempts could really make a big contribution. I would add, and I've added this several times before, and I think many people this morning have talked to this, in that Māori and Pacific Island smokers, and particularly Māori, are a very, very hard audience to reach, and I think for at least a little while, everyone will have to keep innovating and trying different types of services to try and crack that nut. I think it's very difficult to make some carte blanche statements about those cohorts of smokers.
And my final question, Madam Chair, if I may, how important is it at the same time as we do these things to pass a bylaw in order to ensure implementation, in your view?
I mean, we'll be providing objective advice to the Regulatory Committee in the very near future. I think one thing we always have to think about, though, is our bylaw is a law. And, you know, we will be providing advice around what the evidence base is for that law and what the health risks are that that law might try to deal with, and what actual enforcement tools we have available for that. So, as most of you know, we don't have a lot of enforcement tools. So we will be giving advice about prosecution of smokers in public places and how that process might work. I suppose one thing we need to think about is whether many of our laws and policies are targeting specific audiences, often Māori or Pacific Island, and what the justice issues are around that for a law.
Thank you, Margot. I've got Councillor Collins next.
Thanks, Chair. Just the one question on 3.2 in the implementation plan. There's research being undertaken to see what interventions are most effective to develop an action plan to target those most in need. Can you tell us where we're at with that piece of research and when you expect those findings to be made known?
Okay, I'll answer. Through the chair. So local government has little leverage and can only indirectly influence the reduction of smoking in Māori and Pacific people. However, we can support a broader sector who are focusing on those population groups. And so what we've identified in our implementation plan on page 11, which is activity 2.1, is that we're undertaking a research project to understand what interventions are effective at reducing the smoking prevalence rate. And that has just gone out for a public tender. And we don't have a deadline for submissions. I think is that at the end of this month?
Sorry, I'll be much clearer in that answer, Councillor. Because we don't have expertise and this is a highly specialised area, we've gone to a public request for tender for research to be undertaken on both indirect methods, so Council's general role about what are the most effective interventions to affect Māori and Pacific Island cohorts, and what the breakdown of specific cohorts within that area might be, and also what are the most effective direct interventions. So there is a lot of knowledge in the health research sector and we'll be drawing on that. I thought that the RFP was meant to close by September, so that we'll be making decisions on who the researcher is during October, early November, and doing the contracting processes. That will provide the evidence base we need to develop an action plan that has a chance of having an impact on the problem.
Thanks.
Okay, thank you, Councillor Collins. So just to let people know, just as far as questions go, I've got Councillor Close, Simpson, Darby, and I think Councillor Hills, you were wanting to speak to the recommendations. So
Madam Chair, I don't need to do mine if those are the recommendations. So.
Okay, that's good. Councillor Close.
In the implementation plan, under 2.15, 2.16, are sports clubs getting unfairly targeted there? the way that reads as though they've actually all been forced into signing an agreement now and a variation to their lease agreement, whereas 1.8, going back, says insert a smoke-free compliance clause in all community lease agreements as they come up for renewal. Are sports clubs getting targeted to do it now? And I say that because as many sports clubs have done the right thing and built a smoking area at great expense, which complies with the law, and they're on the way to getting rid of it by 2015, but why are they being forced into having a variation on their lease and therefore shutting down their smoking areas when it does comply with the law?
Through the chair, we've worked in strong consultation with the Regional Sport Trusts and Active, who is our kind of liaison with the sport clubs. In partnership, we've been developing a effective way of implementing smoke-free and sport clubs and in that environment around sport fields, etc. So that was the recommendation, and it's a rolling process. As it's identified, it's currently in action, so we're developing it and we're putting it in place, but it's not, we're working with it, with the sector, and making sure that it's effective for the clubs themselves, yes.
Will it end up aligning with 1.8?
Yes, because that is a rolling as the lease agreements
Okay, and the
get renewed.
second one's we're putting it in the sports field application forms as well. I mean, we had a mother that was beaten up for congratulating her son for scoring a try at the Suburbs Rugby Club 2 weeks ago, let alone trying to go around and tell people to stop smoking. I mean, she got beaten up because she was celebrating a try. How do you expect clubs to enforce that without causing potential grievous bodily harm to them?
I think this goes back to the whole point of the smoke-free policy. So it is about denormalisation, it is about working with others to go, these should be smoke-free places, but it is a non-regulatory approach, and there is no enforcement at present. The reason we are looking at council contracts and leases is because you made a resolution to ask us to do so, and sports are actually one of the areas who step up first to work with us on that.
I have two other questions. The definition of outdoor setting. What is outdoor setting as compared to alfresco dining? And does outdoor setting include bars that have outdoor bars but not dining? I'm just a bit confused as to what an outdoor setting is.
Through the chair, sorry, could you just clarify where specifically you're referring to?
I don't know. I think I've seen it somewhere.
So you want to know, is outdoor seating simply
Well, it's been referred to. What does outdoor setting mean?
Setting.
I made that up. I might have, unless it was
No, that was one of the recommendations from the smoke-free groups.
It was one of the recommendations, so...
I cannot speak on behalf of the submitters that have presented previously, but I would draw your attention to the comments made by the Hospitality Association on the distinction between alfresco dining, which is outdoor dining occurring on public spaces, and those other businesses that actually have outdoor dining on private spaces within the businesses that they operate, and that may be part of what that reference was relating to.
Okay, so that leads into my second question, because we're talking about licences. Does that mean potentially we could be inserting a clause like that in all outdoor dining licences, whether they're on council land or private land?
Through the chair, my understanding is that that reference would be in relation to an alfresco dining licence, not to a liquor licence. So it would only relate to businesses that were applying for a licence from council in order to use public spaces for outdoor dining.
Thank you.
Okay. Right. This strengthens my view that we need just a bit more time on this, and in a best case scenario, we would have had the opportunity to workshop these kind of details.
Yep.
I've got Councillor Darby. Is it question or speaking to the regs?
I'll
Councillor
say
Darby?
to speaking, just questions and I guess it's feedback. So just look, I support the direction here. Otherwise, we'd make I think a meal of it today, Chair. So October looks good. I think we do need some information. This is our opportunity to signal that we do need more information on the e-cigarettes, pros, cons. I think we do need to examine the hospitality evidence. So we're going to examine all the evidence that's brought here today from the health providers and Hospitality in New Zealand. I would like to look at this trial from Christchurch, and I'm sure you've got the evidence there. I think there is a good focus on Māori and Pacifica, but originally the policy, Chair, was also drew an emphasis of a real focus on the risk to children. And maybe I'm not picking it up, but my understanding is that something like 5,000 14-year-olds take up smoking every year. It's huge. So picking up on that, some of the implementation plan, Chair, I think needs to be picked up on. The public transport infrastructure, I think the wording's not accurate, too tight there. The Mayor pointed out the question of getting some indication of funding estimates around these 102 activities. It's numerous. I think we need to understand in October at least what some rough order estimates are around these 102 and whether they could be reduced. Questions then?
Yeah.
Madam Chair, they're my feedback for going forward, and we can do more through the working group, which I'd like to be part of. There was a question about implementation of the existing policy. Was phase 1 fully implemented? Was phase 2, which included all shared spaces in it, laid them out by name, but only including the prescribed spaces, all plazas and civic squares? That was in phase 2 for implementation May 15. Was that implemented and supported post-implementation?
To answer your question, it was implemented, but it wasn't, as we know, implementation is more than just putting up signs, and it involves awareness, public awareness, to make those places smoke-free. A place isn't smoke-free unless we do some promotion about it being smoke-free and that there are appropriate signage to indicate that it's smoke-free. So although there was intention and things have been put in place to have them be smoke-free, it wasn't implemented effectively, if that answers your question.
So I don't recall any public announcement from the former council in 2015 that today, the 31st of May, all the shared spaces, O'Connell, Derby Street, Federal, are smoke-free, as are the plazas, Altea, civic squares and other centres as well. I don't recall any PR that went out from our organisation.
They're still smoking.
That's correct, through the chairman, because there was no public awareness campaign funding, or there was no implementation funding overall to do that.
So effectively, phase 2 was not implemented, if we're hand on heart about
I
it.
think I might save our staff from further embarrassment. Some of us remember the debate at the funding committee / annual plan well, and there was an ambivalence around this council table by us to actually adequately fund this. We put CapEx in there for signage, and we actually said that's all we were going to fund. So, I think we need to re-establish our commitment to doing this, because to be absolutely blunt, policy and regulation without funding is simply rhetoric. And, it's time for us to own that. And, I think we've fleshed that out sufficiently. If we are going to do this well, we need to grasp the nettle and actually fund this. We've cut this part of council to the bone, and I, as chair, am not happy to see our staff questioned about why they haven't implemented something that we haven't funded them to do. So I'm going to move on.
Sorry, Madam Chair, I did not criticise the staff. These staff know that I'm on their side.
Absolutely.
And I am criticising us as governors for not following through. The staff follow our direction, and the 3 staff before us have in the past and will continue in the future. What I'm emphasising here is that if we did put money aside for signage, which I don't think we quite did, it was not applied to the implementation of phase 2. Final question, Madam Chair. In terms of the bylaw advice that you might be bringing to regulatory, will your advice to regulatory include reference to the numerous other successful laws and bylaws of the Parliament and of the Council which do not have a policeman or a warranted officer standing by to make them successful?
Through the chair, we of course will provide advice about compliance and what types of laws and bylaws get voluntary compliance and what types generally where voluntary compliance is less likely. And that is potentially a topic when you're trying to regulate a behavioural addiction. So
Okay, thank you.
we will be providing advice about that.
Thank you. I reserve the right to speak, Madam Chair.
Okay, well, that's probably a good point. I think people have signalled. Is it a question, Councillor
No, I
Walker?
just want to move that the motion be put.
No. I'm just going to move the recommendation now. So I've moved it, Councillor Darby seconded. We've already signalled that. That's, if you just let me finish. I've no more people who've signalled they wish to answer questions. So I'm going to move now to the speaking to the recommendation that has been moved.
Madam Chair, mine was simply a question.
Oh, last question, Councillor Fletcher.
Thank you. Katarina and team, thank you very much for the candid way that you have approached this in terms of policy. Could you outline for me, given that there would seem to be a willingness for this to come back to you for further consideration, how that will feed into the long-term, our long-term plan, what policy will be forthcoming, because I think as the Chair has correctly put, it's important wherever we determine our policies that we are looking ahead to ensure that the funding is there. I should have said the Auckland plan refresh, not the long-term funding plan, sorry. But could you just, it's important to me that we're dealing with this comprehensively. We've got the opportunity that the Chair has given us for a review. So I'd be very interested how this will feed into the Auckland plan refresh and those issues of health and wellness, which are really important when you're looking 30 years out for Aucklanders. Could you give me a little insight as to how this, along with the decision today, will be incorporated together?
So you're probably more up to date with the Auckland plan than I am, given the workshops you have been having. But generally, the Auckland plan has moved to a much more high-level outcome-based approach. And I'm not aware that smoke-free specifically is in there and in the approach, yet health issues are covered. So I actually am not as up-to-date as you are about specifics around smoke-free in the Auckland plan.
Thank you.
Okay, and that will get clarity on that.
Yeah.
So we're going to move to the recommendations, which I've moved and Councillor Darby has seconded. There will be a lot of time for us to deal with this. So I've got Councillor Hills and Darby. I'm going to take 3 for and 3 if there are against. So do I have a third person wishing to speak in support? If not, we're going to have a lot of chance to talk this through at a later date. Councillor Hills.
Thank you, Chair. I probably will speak a bit more in October, but I'm supportive of this as long as it's strengthened, as long as we're including the recommendations that have been given to us today. Also, we need to put in consideration that this isn't just a random council idea. This is the government, this is the country's, attempt to get smoke-free by 2025. This is all parties in Parliament. It's not a big deal. It's not a surprise. I remember in 2003 when the Smoke-Free Environments Act, and inside, the national side of the government was completely opposed to that. Now you've got a situation where politics is not split on this. The other thing is, I think it's important to look at things like the Youth 2012 stats. 2003, we stopped smoking inside. From tried smoking in 2001, young people went from 53% had tried smoking in 2001 to 32% in 2007 to 23% in 2012. Smoking weekly went from 16% to 5% of young people down in 2012. The other thing is, when we're thinking about outdoor dining, 85% of people do not smoke. Of course, the perception is that it will cause you trouble, because if you've got a smoking area outside, what of the 85% really choose to go out there and hang with the smokers? Not many. So, we're talking about 15% of the population who we're using the whole maybe outdoor dining area for. The other thing is, I think it's important that we do include e-cigarettes and vaping within this. I used to smoke, and when I see vaping and when I see e-cigarettes, it triggers something in me that I want to smoke. If I see it, I see people sitting around blowing the massive puffs of smoke. I see it, you see it in the car on the motorway. I feel like smoking every time I see that. A lot of people, it's about the triggers. The whole point of removing this and saying you can still smoke at your home, whatever, but the whole point of removing it from the public places is so that young people, people who are trying to quit, and people who see smoking quit. You can't tell if it's an e-cigarette until you get close and then you go, oh good, it's an e-cigarette. That's not how it works. The other thing is the cost of compliance is different too. We need to think about that the Smoke-Free Environments Act was inside. It was self-policing a lot of the time. We weren't sending council people into bars. I was a bar manager when it cut over. Well, I was 18 or 19 when it changed to smoke-free. I remember, a couple of days before, people blowing smoke in my face while they're ordering a beer. A couple of days later, it almost disappeared completely. People knew. The odd person accidentally lit up a smoke inside, and they'd go, oh crap, I'm so sorry, and walk outside. It was a self-policing thing. If we make this clear for those people, they know it's not the restaurant's choice, it's a choice that the council has. Of course, there's other bars that it will not be there, but we're always going on about how, people are always going on, we can't blame the government for everything. This is being responsible for the areas we have jurisdiction over. So when we're giving leases on our land and our public space, this is what it is for. The other thing, I think I'm getting where I've got there, but basically the shisha as well. I remember being 16, 17, we used to go to shisha bars and smoke the shisha at 16 because it was strawberry, it was pineapple, it's these big, it's cool. People think it's cool. And it gets you hooked in, and like you say, it's 10 cigarettes a go. Because it's something novelty, it's something that seems fine. So it's another thing we need to address. I think that smoking, I used to be a youth worker, among young people now, it's not even thought of that the majority of them smoke. They think it's ridiculous. There's pictures of my parents on their honeymoon smoking on the plane. We've come a long way, and this, we were... Collar and tie. We are talking about something that shouldn't be so shocking. I'm sad that we're not passing the recommendations today, but I think it needs to be strong, and it needs to be done, and at least 85% of Aucklanders will support us, but I think a lot of people who smoke, my dad doesn't smoke now, and largely because when he goes to the pub with his mates, they all sit around and talk instead of sit there and smoke. It's been years since he smoked, and he said largely it's down to the fact it was removed from the places where he wanted to smoke the most. So I don't think this is anything that we should be shocked about. I'm sad we're not moving it today, but it needs to be stronger, needs to be implemented, and I don't think it's going to cost that much, because a lot of it is just setting a benchmark and everyone else will fall into place. Thank you.
Okay. All right. So I've got Councillor Darby and Councillor Newman speaking for the recommendation.
I have a few balancing comments.
Okay. So we'll take Councillor Darby.
Thank you, Chair. Well, look, in some ways, I came here today thinking that we were going to confirm an ambitious smoke-free policy revised and implementation plan, and then on Saturday I started reading the document and I thought, no, we won't be unless we seriously amend it. But as you've correctly pointed out, rather than try and amend it on the hoof today and likely make a meal of it, we're best to kickstart it and kickstart it in a much more courageous and ambitious way, and to actually strengthen, because I think if we had have confirmed the paper before us today, we would have been backpedalling. It would be a weakened policy and a weakened implementation plan. I want to acknowledge all the stakeholders, Hospitality New Zealand, Cancer Society, Regional Public Health Service, Hapai, Tala Pacifica, and there was an individual there, and I just cannot recall the name. But this is a really important issue, because you've only got to look at the stats, and if you just ignore the national numbers, which are frightening, 5,000 premature deaths related to smoking. Our own people, 1,700 Aucklanders. It's an incredible one. We give it a lot of attention. I've said this before to, car crash fatalities and serious injuries. But this is 10 times that number plus in terms of fatalities. It's incredible. And we can do something about this council. So no ugly car crashes, but lots of slow, invisible, wheezing deaths, morphine-induced comas, etc. So, and 5,000 children in this country start smoking at the age of 14 every year. And that's what Zoe Hawke is referring to. How do you get on top of that and try and be smoke-free by 2025? When you've got 5,000 kids lighting up every year, you are looking at 2060 and 2065 and 2070 before you become smoke-free, unless you get on top of it. I am concerned about some of the things that were conveyed today around e-cigarettes. I think we need more work done on that. I take Zoe Hawke's point of view on behalf of Hapai, but I also probably lean more towards the Regional Public Health Service and the Cancer Society's view that when you're out there and you view somebody lighting up or using vapes or electronic cigarettes or whatever's going to come next in the e-cigarette area, it is confusing. What is the visual cue there to a young person? And even I am confused when I walk the street and I see somebody on an e-cigarette or vaping. I'm not quite sure whether they're smoking or not. So what does that message convey to a child? The butts in the gutter, the visual cues, all those that are trying to kick the habit. How difficult is it for somebody that's kicking the habit when they see someone, are they smoking or are they not smoking? I think that needs to be looked at. So, Madam Chair, there's quite a few things for us to look at here, but to wrap this really, I think Aucklanders expect us to be stepping up here, not to be stepping back. And if we had have implemented what was on the report today, it would have been a stepping back, in my view. The smoking legislation of a decade ago was just enormous. It was a massive public discussion, and brave politicians in the Parliament put it across the line, and not really one has backed away since. But it has actually made workplaces and cafes, bars, etc., smoke-free, but it has spilled the smoking now out into the new, wonderful, authorised outdoor smoking room, which are our streets, our plazas, our shared spaces, etc. And we've got to get on top of that. I hear Hospitality New Zealand's concerns, but the evidence that they brought a decade ago, that 23% of businesses were going to close, it was the evidence a few years later put an absolute line through the lot of it. Hospitality industry, post the legislation, grew. More people went to bars and restaurants, and their industry grew out of the smoke-free legislation. I think you'll see them grow when we come to confirming that the outdoor settings in all those categories do become smoke-free earlier rather than later. So let's see coming back a much more ambitious and strengthened policy and delivery plan.
Okay, thank you, Councillor Darby, and I think Councillor Newman may well be the last speaker. I think we've run out of puff. Councillor Newman.
Appreciate Madam Chair.
No pun intended.
No pun intended.
Madam Chair, this is a quite difficult one for me because, and as I've said to organisations that have lobbied me on this, I always think of this in the context of my mother suffers this terrible addiction to nicotine, and it is very fraught. So I'm always nervous when it comes to policies and regulations that affect people who suffer addictions, and this is one of those behaviours that is so insidious because nicotine and exposure to nicotine triggers addictions, and I'm a fanatical non-smoker. I would just hate to have this particular addiction. I know that there are behavioural treatments available. I know that there are nicotine replacement products available. There's other medication. But it is, and I'm sure that the smoke-free policy in an amended form will be adopted and hopefully implemented properly, and I may well support that. I probably will support it actually, but the point being that whilst we have policies, and there does need to be funding in place to properly implement those policies, we also are going to need to address a policy by a complementary bylaw that is workable, and that is a debate for the Regulatory Committee, Madam Chair. But, I go back to, a few months ago we passed the air quality bylaw for indoor domestic fires with no powers of entry, which means that it cannot be enforced at all. So what happens is that at the front end you get very impressive speeches, but when it comes to the implementation, that can get a bit debatable, and when it comes to the enforcement, that's questionable. I'll be interested to see what regulatory impact statement is appended to that report on a bylaw when it comes before the Regulatory Committee. I'll be asking questions about that. So, Madam Chair, I support the recommendation today, but I hope that we can do a lot more than just arrive at a point where we've adopted a policy which, you could argue is pretty tough on people who suffer what is, in effect, something that they are addicted to. Nicotine has a powerful addictive quality, and if people suffer that addiction, I'm sure that most people who smoke wish they didn't, and many have tried to stop smoking, but for those of us who are non-smokers who can declare our position in favour of smoke-free, I think we do need to balance it up by thinking about those poor people out there who do suffer these addictions and who have to live with the consequences of it. This policy doesn't necessarily make life any easier for them. I bet they wish they didn't smoke, but we have to ensure that whatever policy we do implement, it is balanced and it's enforceable and it's practical, given that some people just can't switch off today and say, I'm never smoking again. Thank you, Madam Chair.
Okay, thank you, Councillor. I'm just going to, at the risk of opening everything up, we've had Councillor Darby has signalled he's interested in being part of the working party. Councillor Cooper is part of the regulatory group. Councillor Collins is, given the stats down south. If I could have maybe another couple of people signal their interest. Councillor Hills.
Councillor Quacks put his hand up.
Does that feel like a reasonable?
And because of the
IMSB, absolutely. I wouldn't dare suggest who from the IMSB, but obviously IMSB member. So we'll have IMSB member, Hills, Quacks, Cooper, Darby, Collins.
Hills.
Okay.
Hills.
Madam
Hill.
Chair,
We'll
sorry, I'm going to be away for the whole of September on leave. So if you're having a meeting in September, maybe it needs to be something. I can still be in the loop and reading.
We can finesse
Okay.
this. I just wanted to get some names there, and people can sort of move in and out of that. And again, IMSB member to be determined by the IMSB. Okay, I'll put those recommendations. All those in favour, please say aye.
Aye.
Against? Carried. Thank you very much. And I just want to acknowledge the staff who've worked tirelessly on this issue. It's a tough one. Thank you.
And the Cancer Society.
Oh, we've already acknowledged all our people, everybody who presented. Thank you. Councillors and members, we are going to take a 3-minute break. What we're going to try and do between now, we're going to be breaking for half an hour at 1:30 for lunch. We're going to try and do the climate change item, the coastal plan, and a 1-minute item on the Teed street arts plan. I do know that Angela has said she wishes to speak to the homelessness issue. Homelessness will be on the agenda at about 2. So I'll just give Angela a moment to think about whether she wants to quickly say what she wants to now or wait until 2, but we do need to take a 3-minute break. Thank you.
Okay.